I'm kind of interested in three, four things. Primarily people's first experiences with open data, but then perhaps challenges and what advice they would give to people coming for the first time. So yeah, I'd definitely like to throw that over. Vanch or Alicia, if someone would like to just jump in and say what their first experience was, or Kate or Zachary even.
Sure, I can go.
Sure.
Yeah, so my first experience with open data was it's kind of hard, I think, to sort of navigate, like if you want specific parameters. I don't know if it's the most user friendly, so I think a big barrier would be you would have to have some level of proficiency with sort of recognizing what exactly data sets you're looking for. Right. So if you're not trained in that, that might be a little bit difficult. You have to have some level of technological proficiency. Right. So like that might be a big barrier for somebody accessing. So my advice would be just be patient, keep playing with it, and just utilize it to the best of your abilities.
So maybe you could just say a little bit about your own background and coming towards it, because it feels like you have a certain amount of experience or skill coming into it.
Yeah, so I actually work for the New York City Department of Health. And a lot of what I do is sort of equity research. And one of the things I'm most interested in is how we can use data in a way that highlights some of the root causes of the systemic inequities that we're seeing in health outcomes for New Yorkers. So trying to figure out what, for example, like the demographic information for physicians is, right? That's not readily available in New York City Department of Health data, and it really should be. So sort of trying to like identify where the disparities are, what the root causes might be, and things like that.
Wow, cool, super interesting. So, Vanch, do you feel happy to talk about these? I'm guessing relatively new experiences with open data. So that would be cool.
Yeah. Firstly, for the challenges, I would say, as Alicia said, like technical proficiencies, and you have to have that required skill set for doing data analysis. That's something I feel, because I'm like at a very beginner level, so I don't know how to do very advanced technical data analysis. So that I think is kind of a barrier for me. Um, Secondly, I would say, because I'm not a government major, I don't know like much about social sciences and everything. So at first, it's kind of hard to know like what are the right questions to ask when you're looking at a data set. So what I did was I just played around with a bunch of tools with NYC Open Data platform, and once I got the idea of it, the basic understanding of how things are like happening, then I got a little bit better understanding of what questions to ask, and you know what I mean, because I don't know how to phrase it, but if someone does not have like a perfect background in government or political science, it's kind of hard for them to look for specific problems. But there are a bunch of other data sets available. Like, for example, we have a data sets about squirrels in Central Park. I think everyone can access that and have one way that we have 311 data set available. That can give you a lot about the complaint types and what's going on in your community board. Those are the data sets that I played around with and I got a little bit comfortable with. Yeah, so that was kind of my experience.
Cool. That's really nice. I like that idea that it's playing with the squirrels that gets you into the data. So, Kate, you were saying earlier that you came from a slightly different approach. Sorry, Kate Mooney. I'm going to say Kate rather than I'm going to say Kate M and Kate N. But even that's too close. So, you were saying that this came that from your perspective, entry came from the germination of legislation. So perhaps you could speak a little more to that, and how that reaches the kind of challenges for when constituents are coming forward.
Well, yes. Actually, it's probably more complex than that. It's not as if one has the time to probe the data and then bingo, a light goes on. It's more one would have an idea from experience and then probe the open source to see if there are, in fact, public interest in that area. So one thing that Alicia brought up, which I find is interesting, is those issues of equity. And I don't want to completely, Graham, put your question to the side, but maybe they're related. For example, I did not before tonight, and I'll go maybe later, or you could help me, see what we have on COVID in your source. Maybe one of you can tell me what's there. Is it your source of the metadata is our 311 calls, and then what are the agencies spilling into the data? That's what I'd like to know.
So I might be able to answer that just because I do work for the Department of Health, and this is something that we train community members on a lot, actually. And the New York City Department of Health website specifically has the data for cases. They have the data for hospitalizations, deaths, and they actually do break it down by ethnicity. And what we've actually found is, despite the fact that the demographic racial majority for New York is white, Black and Latinx New Yorkers have the highest rates of each category. So there is a lot of data on the COVID-19, but you might not find it in the open data. You might specifically have to go to the Department of Health website.
Okay,
no,
yeah.
There it is. I think somebody found a link.
Oh, okay. So because, that's a kind of like a inequity in the city that we're well aware of, especially in Southeast Queens. The council members district is in Southeast Queens. And I have been looking for deeper information there. So how many of the Black or Latina that have been affected by COVID actually come from our district? We have all experienced so many deaths down there that I know the numbers are really high. But of course, the city is interwoven with Black and Latinos all over the place. So I was wondering, is there some way I can find a map of COVID deaths for my district, or a map of essential workers who've come down with COVID for my district? Because at least from a legislator's point of view, you're always going to be very, very local, right? I'm not working on problems in the Bronx, right? I am working on problem in District 28. And I'm going to theoretically, I'm going to open source data to help me understand who are my people and what are their experiences. So although I found tonight, I think this is fairly new, Kate, that you brought this into the whole mix here, is that wonderfully helpful dictionary. I think the dictionary is very helpful because it gives you some basic terms that help you peel away at the layers and target in on what you're looking for. But I do think, in fact, it's kind of deficient on, as Vanish mentioned, on the social sciences aspect of it. All the data is a little weak because we don't ask those personal questions that you really want to know about.
Yeah, and I don't want to take up too much space, but that's one of the big questions that we do ask in our equity work, is because when somebody makes a dictionary, we all have implicit bias. So if I'm making a dictionary and I'm not including the diverse aspects of race and ethnicity and ability and gender and sexual orientation and all of those things, and I am in control of making a dictionary, then my implicit biases are going to be incorporated just like they would in sort of like a computer program, right? If you have biases and you're designing or programming a code, right, your biases come out in those definitions and in those codes. So that's one of the things that we really need to start focusing on when we do talk about data collection in equity.
But you also need a public who's willing to reveal that data. And that's more private, right? If I'm calling to find a COVID vaccine in my community, I won't want to say, I identify as XYZ or LGBTQ as the letters go, and I wouldn't want to necessarily say I'm of Caribbean descent. So it's hard I don't know how you're going to make that next step, take that next step, that where a social scientist would be more interested in those aspects, whereas the factoid is interested in, I need a COVID vaccine.
I can also, I'm so sorry I'm taking up a lot of time.
Well, it's just
Alicia,
it's okay. I got time there, Alicia.
But this is literally the work I do. And I actually do come from a social work background. I don't have technical training in data science, believe it or not. I am going back to school for it now. But as you said, it's absolutely true that a lot of people that are registering might not be comfortable disclosing that information. But the reason it's still so important to ask is because we do want to prioritize those communities that have been the most impacted. And we do have the numbers for those communities. And I sent you that link, and you can actually, they do have maps that show you by zip code, right?
Oh, that's true.
Yeah.
That's true. I just discovered those a week or so ago.
Yeah. So, and honestly, the real challenge that we have as the health department is getting people to trust what's happening, getting people to trust the vaccines, getting people to trust us as a government body to sort of give the proper information, because there is a history of medical abuse, especially for marginalized groups. But one of the things we're really focusing on now is community-based organizations. So going out and leveraging community relationships to sort of help us collect, have New Yorkers feel more comfortable in disclosing those sort of things, and having community-based or faith-based leaders sort of lead the charge in these instances. And that's a really big piece of it. So I think you're absolutely right.
It's interesting, just building on, excuse me, what Alicia and Kate, you were both describing. A couple of things come to mind. One is the sort of, I guess, almost like misalignment in a way between the level of analysis that you in an assembly office, Kate, would be interested in versus, for most agencies, the level that they would be conducting their business on. So exactly, you wouldn't be concerned with what's going on in the Bronx. And for most agencies, they align somewhat by either like functional area, in which case it's citywide. And obviously, like there are certain things where people would look at a particular smaller geography, like of course during the COVID pandemic, but then also by borough. And if those are the two like predominant areas of analysis, then the data that's available would be really like focused on those two levels. Either that, or it would be more specific, and with this where the map works really well, like displaying data in some sort of aggregate. But if you get down to individual people, then that's where there's a privacy concern. And certainly, like from the perspective of New York City Open Data, we post a lot of information at the lowest level possible. So whether it's like a census block or an individual, like we want to get to that smaller level. That's because for different purposes, people would want to add that data up in different ways. So you may be interested in aggregating it to the assembly district. Someone else may want to aggregate it to the council district. And like, instead of posting 50 different versions of the data for everyone who wants their own use, the idea is posting it at its lowest level. And then for better or worse, people would then have to like aggregate it to whatever level of analysis they're interested in. Right. Which for COVID in particular, I'm definitely not an expert in that data, that specific data, but is a challenge for privacy reasons. It's a conversation that we always have with agencies around releasing data, of like making sure that we're protecting people's privacy. But at the same time, like it becomes very difficult to then look at this in a way where it is an essential repository with all this other information and making it available. If we don't have it there, if it's on every agency website, like then you go on this, certainly there's things you're interested in, like 311 or COVID data. But if you want to find more data sort of on a geography level, how would you do that? Like you'd have to go to every agency website, or in the open data, you'd have to go through many different data sets for different agencies. So I think like those are all things that we talk a lot about, and have, there's certainly some ideas of how one might improve the way people navigate through this giant mass of information that's available.
Well, I think that's part of Anisha's job, isn't it? I mean, and I know that we were not going to be funding an open source data, whatever, worker, but I think that was one of your budgetary asks, right? And I think that would be the way for a council member to really plumb all the options, which is you have somebody there doing this. I was saying with Kate that we were getting a snapshot, and that's what she called it, snapshot. And it was 311 data. But what I think, Zach, you're referring to is bigger and broader agency information. And anyone who is curious about or responsible for such a large number of people needs someone who's analyzing. And this is the world we live in now, right? We're so data driven. That's what it's all about. And I was shocked when I was doing the census. I'm saying to myself, what kind of data is this? You got 10 questions. There's like nothing, no there in the 10 questions. But apparently some people can spin this well and get a lot of data out of it. But I think it would be wonderful if one could call upon someone and say, listen, could you hunt for this or pull these connections together for me?
So there kind of is a little bit of that. I wouldn't say that it exists fully because it doesn't. But one, if you're looking for a data set and you're not sure like if it exists or where it is, or if like the thing is in the data set, you could send, I shared a link before, I could share it again. You could send us a message and either we'll answer it on our team, the Do It team, the city's IT agency will answer it.
Okay.
Or in most cases, actually, we wouldn't answer it at all ourselves. We would send it to one of the city's open data coordinators. So every agency has a person who's responsible for that agency's open data.
Oh, okay. I didn't know that. Thank you.
They're not always experts on every data set, but they know enough to know the people who they should be asking to get more information.
Mm-hmm. Okay, that's really fun to know.
The other thing there actually is and this is where I think like it becomes really complicated to have like one person in legislator's office who's yes, like it's fantastic that that's being done, but even then, like as I was saying, there's just one person for an agency who's responsible for their data, but there's so much information there that most of the time they have like a baseline understanding of what everything means. But if there's any detailed question, like you were asking about like the different fields and what those mean, they would actually go and ask someone else. So there are really like to publish an open data set, there's probably for most data, especially for larger ones, like 4 or 5 people who are involved in that process. And if you multiply that around the city, there's hundreds, if not over 1,000 people that are like responsible for publishing data sets and regularly involved in contributing to documentation, contributing to how the data set is being structured, the extraction of the information. Like there's a lot of work that's happening sort of behind the scenes. And it is this continual challenge of like, how do you translate that much complexity of this giant organization so people could make use of it and understand it and make the city better? Open to ideas there, but that's something we're continuing to work on.
Yeah, great.
So I kind of have a question actually aimed at everybody, because I think you all kind of fill this role in different ways. But do you ever feel like you're a gatekeeper towards all of this? In some sense, people, either informally or formally are asking you questions just perhaps because you work in, you have some greater connection towards the data, that do you then feel that you are a conduit towards that in some sense?
You mean like Lucy, who used to have her table and she would have, you for a penny, she'd answer your question?
And then if you didn't, she'd pull the ball away from you when you kick it. Yeah, for sure.
I might be able to speak on that a little bit. So one of my main roles is I actually do presentations and trainings with community members on COVID-19, mental health, and social inequities and racial inequities. So it is kind of like that, Graham, because we have a group of people that come together and they plan out these presentations and they develop content, and what goes into that content, right, is very much dependent on what our goals are as the Department of Health. So I would say yes, but also something that we do that I really enjoy is we do empower individuals with the resources. So I can give you data, but we also make sure that they get the links to where we got that information, right? So if they wanted to go and do their own research, then they can. But the content of these things, it's just it meets the goals of what we're trying to do.
And would you, are there any steps beyond providing a link towards where the sources of data come from, perhaps how to translate those sources into, you know, as Vansh was saying earlier, that it's difficult sometimes, even if you're presented with the sources, to know the questions to ask or how to ask them?
Yeah, absolutely. So what we do is, the way that we have it set up is we do present the data. So we do present tables that are super easy to understand. We explain everything. And then what we do is we do a breakdown of the root causes, right? So we talk about how there's racial inequities in cases, hospitalizations, and deaths from COVID. And then we go into a little bit of, well, what's happening there, right? What are some of the social determinants of health that are going into this, right? So people have a better understanding of some of those things. But as far as like navigating data, that's definitely not something that we do on our part, no.
So I'm just thinking of one area that I don't know where I would find this, but it's, how do you locate those who are food insecure in our district? Again, I'm always speaking, you know, I'm looking for a geographic area because I have been involved with distributing food and I'm relying on the same old community-based organizations, whereas I know there are many, many more out there, small community-based organizations that don't know that they are one, for one hand, and also for the food insecurity. Now, 311 might have all the calls, where can I get food? But am I going to know where those people are who are seeking food and where are the pockets? How do I, Graham, I've completely taken you off your...
No, this is good. But I'm going to throw that at Kate N, who I feel does some of this kind of...
Yeah. Can I share my screen?
Yeah. Do you have? Do I need to?
Let me see if I can do this. So BetaNYC, when I came to Beta, and first, like, I'll just introduce how I came to Open Data, because, you know, I grew up in New York City and didn't discover Open Data until I attended randomly a class at BetaNYC. And it was, you know, I have a background, I studied economics in college, and like was doing my dad's spreadsheets for taxi receipts when I was like 6 years old on spreadsheets. So like, I'm very acquainted with like data and spreadsheets, but I had no idea about the Open Data portal until I attended a BetaNYC class like 3 months after meeting Noel at a civic tech event. You know, we learned like basic things, like basic functions, which I knew how to do, but the brilliant thing to me was like, oh my gosh, there's all this data that, you know, like you can do stuff with. But of course I still was like, all right, well, I still need to know something else to like actually be able to do it. So fast forward, and now I work with BetaNYC, and I think Vansh, you're familiar with, actually you might not be, in the past, our Civic Innovation Fellows have created and also done or filled out these worksheets, which Kate, you might remember as well in the class. We had these sort of open data journey worksheets, which Emily developed with the Civic Innovation Fellows. And when the pandemic hit, I was kind of, and I'm in charge of events, I was kind of like, well, it's like a great chance to turn these worksheets into something virtual, where we sort of use, and let's make more of them. Let's create this worksheet that takes you through using open data with different tools around like a topic, and let's make it interesting and engaging to people. And so I was sort of like, it was confusing to create these journeys. And at one point I found myself in a Miro board, kind of, I have a degree as well in design, and I started to like throw my like design thinking, like visual, playful sort of self into it, and got us all on a board, and it was cool. Let me share my screen. So we were trying to figure out like what would it look like if we did an open data journey with the goal around parks, and the goal would be to introduce people to interesting data sets, interesting data tools, and interesting like topics like social issues, things that are relevant. And so what we found was, we need to start with a question, and then we answer it by using a tool, and the tool sort of is harnessing these different data sets. And we designed like a sort of journey based around questions, tools, and data sets. And it's not perfect, because it's like who actually cares like about who's asking these questions? I don't know, but like it does introduce people to these and so I guess what I'm saying is like, yeah, we sort of have these questions, and we sort of then go through the tools and say like, what are the answers we can find with these tools? Where can they lead you? What sort of questions might come out of them? And what can we teach people along the way? And like, what action can you take at the end? Like you could create a report of conditions for your park so that volunteers can help address them. I don't know if this is helpful to see, or if this sort of gets at questions. But so it was, I had Z in here who knows some things, and he was throwing in screenshots of maps, and other people started to. And it was a very collaborative and collective sort of process, because like I don't know everything, but I know who to pull in the room to be like, tell me the civic tech tools that exist. And that's where my BetaNYC community comes in, and they know a whole lot more than I do about the tools that people are developing. BoardStat is just this random tool amongst a sea of like open data tools. So like I can help facilitate these coming together, and like maybe we can craft something. I need to know from Kate Mooney, like, what are the questions you're asking to like help improve your district? Like, what do you need to know? And I did talk with with Councilmember Ku's office, Elaine, to learn. And I think the journey ultimately ended up taking a bit of a different direction, because I learned that they're interested in understanding like park attendance and usership, and so we added some elements of that into the journey. But yeah, starting with like a question, and like then having an idea of like what you want to end up on was kind of like the big sort of guiding things. And then once you have those, you don't get lost in this muck of like, oh, everything's so interesting, and you can better like ask people direct questions that help you get from here to there. I don't know if that helps.
No, that's really good and helpful. So yes, you need to go that deep to come up. You need to take the dive and then come up out of the water. And you've got you're a little bit closer to your questions, and bringing forward to the public a concrete concern that are more general than the individual. Yeah. For example, the council member now is chair of public safety. And with the whole police reform movement, I would love to be able to do something of this equivalent, Kate, for criminal justice, for example.
Right. Yeah.
How many formerly incarcerated? Where do they live? Are there job opportunities in that area? I mean, these are the kind of questions that could drive the research. How many of them have completed their high school diploma? How many are in, college, or they are veterans? Or
it's like there's people with questions. There's people who like understand the data, and people who are like building tools with the data, and like bringing them all together in a room to sort of like exchange. And I guess one question is like, should everybody be doing a little bit of everything? Or like I'd be curious to know like anybody, like where have you tried to use open data and then just like stop because something like got in the way of you continuing? Like you thought the data set wasn't full enough, or like you didn't understand the terminology in the data set, or like what was it that turned you away from the open data portal? Like you couldn't find the answer to a question you had, or
I think we're pretty much saying the same thing. I mean, it just takes a lot of time.
So this way of thinking about posing questions and journeys, is there a way of translating that so that it becomes part of the immediately public-facing process? And I don't think this is I don't think it's a very well-put question for starters, but I don't think it's a very simple answer to it. But I'm thinking of, when I've gone to use the open data portal, almost like the starting point you have to have is some idea of a data set. And that's like the starting, or who might own that data in a kind of city organization sense. And I think this gets back to something that Vansh was saying right at the beginning, that knowing how to formulate the question, even what that question could be, you know, or as much as how to answer that question becomes difficult. So yeah, I guess kind of throw that at Zachary as the man responsible in some sense for the way things are, and Vansh is someone who is very kind of close to asking those questions at an early sense, and see what you both think. And it's Malgosia as well who's hiding under the Open Data Week Room 1 anonymity, and I'm going to throw that out to Malgosia as well.
Yeah, I need to change my name right here. Yeah, I mean, I'm happy to share here, just in terms of yeah, I mean, I guess I was mostly intrigued by your question about being like a gatekeeper, and I don't necessarily ever, having worked on open data for New York City for the last over a year and a half, I guess, just under a year and a half, but I never think of us as gatekeepers. I always see us more as kind of enablers and empowering others to be able to access the information that is rightfully theirs, because it is written into law that all this data should be available. It is a wonderful effort at transparency and keeping government accountable. And we are, as the Mayor's Office of Data Analytics, working together with DoIT, here to make sure that data gets unearthed, working with a lot of staff members at different city agencies, our liaisons, our open data coordinators, to make sure that all that information is there and that the public can use it. And Open Data Week is one of those ways of engaging people and making sure that the data is really being used, because if it's not, then all our efforts are really in vain. So we're just one part in this big effort of empowering people and enabling people to make the right decisions with the right information, with the right data. So that would be my my 2 cents here.
Cool. So maybe kind of continue with your story of how you came into, how you came into your position, and how you first came across open data, and then because you it feels like there's a story there to say about how something can support interest and maintain interest and become something that you feel very passionate about.
Yeah, I'm at a loss to remember the first time I ever encountered open data, but definitely I had a past life at data analytics and consulting, first economic consulting and then management consulting. And so definitely that was basically my bread and butter for all the years before graduate school. So yeah, very, very well acquainted with, I guess, all of the aspects of data analytics, which I think is very useful in the job that I do today, just because it allows me to understand and relate to the data scientists that the Mayor's Office of Data Analytics works with, and just understand, I guess, the challenges that people face when accessing data and working with it, just from like that kind of hands-on perspective. So, I mean, I think that is also one of the reasons why we have so many like workshops as part of Open Data Week, just around like empowering people to, even if it's like a basic Python workshop, like even for people to understand, like, what does it even mean to code, to take a data set, to play with it even a little bit. I think that goes a long way. I think there's that big kind of barrier initially of just like approaching data, approaching coding. And once kind of that clicks, then this like whole world and universe opens for people. So yeah.
Cool. No, thank you. I think that's kind of super interesting. And Vansh, I'd love to hear from your kind of perspective, the technical skills that either you brought to to open data, or that you've learned kind of in the process?
Technical skills. I was actually hoping to listen to all you guys, but right. So in terms of data analytics and analytical skills, I'm definitely on a beginner level. And when I was actually teaching the NYC Open Data class, I had to go through various data sets and practice with them with my community board and everything. So I picked up few functions. For example, let's say filter, sort, and you can group by and everything on the portal. So that gave me an overall understanding of how you can use these functions to dig deep into specific. How do I say that? For example, the COVID data set, right? It tells you if you can just sort it through the count of deaths, you will know like what is the peak month for that year, and you'll know like what month has the most number of deaths and so on. So I don't know if that answered your question.
Yeah, no, it's cool. It's because that step, that some of those early steps, and to kind of tell a story. My interest in open data here, particularly in learning about open data here, came because I went to a BetaNYC event. When I first came, I was first in New York about 3 or 4 years ago, and I was super impressed by the manual sorting, the game of lining people up according to height, and then moving people around according to borough. Covering these query notions, quite technical notions, in a very easy, hands-on, very friendly way. And I can see Kate.
Yeah, I enjoyed
ahead.
that too. I enjoyed that too, Kate, at our first meeting. Yeah.
And so I'm always looking for things like that, about how complex. And I think they are. I think that there's quite a high barrier to understanding those terms, but how complex terms can be explained in really simple, practical ways. And I think that to me, that's driven most of what I've kind of been doing around this ever since. And I don't know where that's going in terms of asking anybody a question. That was largely me telling a story. But I guess I can throw that to both Zachary and Kate in terms of that's such a particular thing, and almost where it comes from, how it developed, and where it leads to.
This is the human pivot table.
Yeah. I mean, I think this is Noel's baby, isn't it? Really.
I've seen it before. I'm not actually sure where. Kate might be the better person to answer this. I'm not sure where it came from. I've definitely seen it in other data education classes, but yeah, I'm not actually sure.
This was also my first experience with BetaNYC, so I'm not sure. I was under the assumption that it was like Emily and Noel, but I don't know. I know, so there was also a card game that they had at one point. I remember playing it. That might have been something else that they were developing, but I don't know where that got. One question I wanted to just ask Vance is that I know that this year's cohort of Civic Innovation Fellows is only a semester long, so the curriculum has changed. But I was just curious, is your class not learning R or beginning to code and whatnot? I don't know.
At BetaNYC?
Yeah.
Oh no, we're not.
Okay. Yeah. So this year the fellow program was to sort of use the Open Data Ambassadors Program curriculum as like this, because it's 1 semester long. Normally the first semester is spent doing like the boot camp, and then the second semester working on projects. So I would have been curious to learn about like if learning certain skills like R, where you can begin to like visualize data and play with it and analyze. Analyze. If that opens up like another world for people, the second that they're able to start like playing with it in more ways than just than the filter sort like sort of tables.
I can't remember the great author's name. I was just hunting for the book book now, but visualizing information. I mean, this
Edward
be
Tufte.
the origin
Tufte.
of all of this. Yes, yeah,
Good old tough
right.
day.
So that's a long time ago.
Yeah, it's still very relevant.
Yes, of course.
Still very relevant, very relevant. So, Alicia, can I ask a little more about how you might translate data or data findings for community outreach?
Yeah, so one of the things I mentioned this briefly earlier was we're trying to target certain for example, we're trying to target certain populations that have been the most impacted. Maybe I don't understand the question. Can you repeat?
So, so I, unless I misunderstood you, I think from what you were saying earlier, you both use data to inform communities in terms of encouraging people to be vaccinated, to be safe, to take good health measures, but as well as being interested in understanding the data about those people, and I'm interested in how you make the former understandable. Express those. This is safe because.
Yeah.
And then B, whether you report back on the things that you find out about when you're collecting data in the field, for want of a better term.
Yeah, so I think one of the biggest gaps in data collection that we have at the Department of Health and Mental Hygiene is that we get a lot of quantitative data, right? We keep collecting the same things, right? Rates of diabetes, rates of chronic diseases, things like that, right? But we never really ask questions about the why, which is sort of something that I heavily advocate for. But we can't come up with those answers, right? So for example, when we talk about like, well, why is it that New Yorkers don't trust the vaccine, right? We can make assumptions as the health department, right? But at the end of the day, you have to talk to the community. And you have to get that qualitative data because we can't answer those. And I think that's where a lot of times government bodies sort of miss the mark, right? Because we've been doing, I'm so about equity, guys. I will talk about this all day. We've been doing equity research, for example, in health outcomes for decades, right? So why are there still health disparities? And I think that's a big part of it, is we don't really talk to those communities. We don't really get that information. So we do know that there's a lot of mistrust, but why, right? How can we address it? We don't have that information yet.
Cool. Okay. Yeah. No, that makes sense. And I'm wondering whether there's a bridge between those questions and the questions that might open up open data more. I don't know. I think that there could be something in linking more qualitative whys and encouraging more whys that would allow people to have a different route in potentially into quantitative data.
I actually came, so I'm so into this and I'm so passionate about it. And I'm absolutely not dissing the Department of Health and Mental Hygiene. They do excellent work in a lot of great areas. But I got to a point where I had to do a presentation on our disparities in data collection. And I came up with an exercise, the but why, right? A but why exercise. And I'm talking about a room full of like policy analysts and evaluators. And the but why technique is identify a disparity and using the but why technique come up with root causes. And it was just like it was a very interesting exercise to see, because we're so interested in the quantitative, but we really just don't look at the qualitative. And I think that's again, I think it's unfortunate. I think it's something that we really need to be focusing on.
I would agree with that totally. The qualitative and quantitative are the good mix. But the open data that we need to be accessible to people to start asking questions to then dig deeper into the qualitative. If people aren't engaging with the open data at the first place, then they're just making assumptions and putting out statements that like have no valid or evidence behind them. So it's like, okay, like how do you even start? Like the qualitative is only so good and the quantitative is only so good. So like, what is the like sort of tango, right? And can more open data like participation lead to more and better qualitative digging and like design research and everything, right? But,
yeah, I think a lot of that does have to do with like the literature, right? You can start with it's exactly what you were talking about before. Is like Kate is like coming up with the questions that we need to ask to sort of figure out what we're even looking for. And there's a lot of great models. Fortunately, we don't have to recreate the wheel on that. There's a lot of good research out there that does sort of, and again, going back to health, does sort of highlight the social determinants of health and things that impact health outcomes, right? So for example, representation in healthcare, right? We just respond better. Our health outcomes are just better when we feel like we're represented in some way by our practitioners, right? Whether that be racially, ethnically, spiritually. What research shows is that it leads to better health outcomes. So why aren't we collecting demographic information on, say, practitioners, right? And I actually did look this up in the US Census Bureau information, and it was like something like in the Bronx specifically, like 90% of practitioners were white. We don't collect that sort of stuff, and it's hard to get that quantitative when we're still kind of but there are ways, like for example the Medicaid system, Medicare, Medicaid, they do survey their individuals. They do check on things like have you gotten XYZ vaccinations, have you gotten XYZ evaluation, right? And they hold their healthcare providers accountable in those things, and they do collect some of that data. So it's not impossible, right? We can do it. But going back to New York City Open Data, that was sort of what I was trying to talk about. And not dissing New York City Open Data. I love it, right? But it does lack a little bit of that quantitative sort of qualitative. It's like what, 7:30 at night. I think we do have a long way to go in terms of getting those answers.
I'm aware that we're kind of pushing on. We're heading towards the long end of a long day. I want to wrap up and just throw out one quick question to each of you, and that would be, what would you do to encourage one person who had never used open data in any way, shape or form whatsoever? What would you do or say to encourage them to have a go?
How much do you think that light bulb is, and point at a street light lamp?
Okay. Good question.
How much do you think the city spent on that light bulb?
And then you can talk them through.
And I could talk them through the capital budget data or something.
I love that. Like, so like maybe they have an issue, right? Oh God, there's no dog park by my house, right? And oh, well, by the way, did you know they have data on that, right? Dog runs, right, in parks in New York City. Right? I like that, focusing on an issue that they're having or something that affects their life directly, and then sort of encouraging it.
But yeah, I guess like I'm a little biased. Like that's the way I've been thinking for a while. So I'm curious. I shouldn't have said that first. Now I'm biased. Can you say something that's different? What were you thinking?
No, not at all. Not at all.
Vance, do you have any ideas? Like, if you were to like get somebody to go to the open data portal, what would you ask them?
Obviously not anything much different from your answer, because everything has some kind of issues in their community district. So you can obviously relate, ask questions about that. They can obviously relate to that. Also, I'm not sure. You can always tell them it's free to use. People just love the free word. I'm not sure.
That's true.
So I had two answers. One of them is very similar to Kate and Alicia and Vanch, which is like start with something local and something that they care about. Like every time we're talking about open data with anyone, the question is always, well, what does it look like for my neighborhood? And like once you're able to show somebody data at that level, like that's when they're like, oh no, there's a mistake in this data. Like, this can't be right, because I know like this person across the street, like they put in a request for this. Like the tree's actually over here, not over there. Like people get really interested when it's like about them, and it could be something they care about and like they're concerned about, but it could also just be something like that they're like they want a dog run, or they love to go, and I feel like I'm naturally going to parks data as my former place of employ, but like connecting to something that someone cares about. The other thing I think that has been successful, and is another way we're trying to connect people with open data, is like show them like a really cool like thing they could use, like an app or a website or something. Every time I've talked about the how's my driving.nyc site with the class of students, the question is always like, well, what does my license plate show there? Like this person that cut me off yesterday, like if I put in their license plate, you mean like it would tell me like what tickets they have? And like anytime you have like a cool application of open data, so like around the pandemic, like the sidewalk widths map, that is the session tomorrow on Saturday or Sunday over the weekend. People are really drawn into that as well. Like when you have a cool thing, like, did you know this is actually from this giant mass of data, which people don't really care about. Like most people don't want to look through 3,000 data sets for the 2 or 3 or 10 data points that matter to them. They want to see either like for their neighborhood or just the really cool thing.
Yeah. To that point, like I'll use the boundaries map a lot. And if I'm ever speaking to like elected officials who love to like see all their cross sections, BetaNYC's boundaries map is just like glorious to like go to, because like you're like really like looking at all the lines and you're like, oh my God. And then the first question is like, this is insane, like that all of our boundaries are drawn this way, and like etc. But it tends to be my sales pitch to some elected officials.
Alicia, final word. What would you say to someone who's never used open data?
I'd honestly probably sit with them and assist. I love the open data. It's just not, if you don't know, your parameters and what your domains, and you don't know what that means, it can be a little bit difficult to navigate. And I don't come from a computer science background or a data science background. So it's, as a person, a social worker who's like struggling to sort of figure things out, I would say, again, just be patient, stay with it. There's a lot of great information that you can access freely, and it's a great resource.
Cool. I think I'm going to wrap up.